ScribeEMR was introduced to Langley Health Services back in 2019. Our Chief Executive Officer, Thomas Chase, was looking for a mechanism to solve two issues for us. One issue was just to try to improve upon the work-life balance for our providers, and the second was having an issue with unlocked progress notes. An unlocked progress note is a medical encounter that cannot result in a bill. We will not be able to generate revenue from an unlocked note.
For me, the biggest of the goals was probably making sure that our providers had the right work-life balance, because it was becoming apparent that the implementation of our EMR was going to take quite a bit of their time. So rather than trying to figure out ways that we could piece together resources for a various different eclectic group of providers, they offered an opportunity for doing something that was very tailored to each of the providers that wanted to do it and that we wanted to make it available to, and it worked quite well. I think it's realized the first goal, and that is keeping our providers' work-life balance appropriate, and second of all, we've actually improved, I believe, in patient quality and in the quality of the encounter itself. What is in the record is now much superior to what it would have been otherwise.
Well, the benefits are multifactorial, really. By utilizing the transcription piece of ScribeEMR, our providers are able to complete their medical record timely during the same day, reducing their need to have to document in the evenings and on the weekends, so there's some enhanced work-life balance. We can be ensured from a compliance standpoint that the records are complete and accurate, and they develop an actual relationship with their dedicated Scribe team member.
I've seen it improve the work-life balance for our providers. They are able to devote time to their patients versus spending that extra time charting documentation, working in the electronic health record. It allows them to focus on the medicine aspect. So yes, they're able to spend and focus their time where it's needed, with that face-to-face interaction with our patients. So it's been a great benefit. It's a total different component when you have that live person. They are able to capture the entire visit and able to formulate that note. I think that's something where the scribe is able to learn how that provider navigates through the health record, and that's something that I think Dragon and those type of programs can't capture. Providers are able to go home with most of their charts, if not all their charts, locked, and I think for us that's been the most noticeable change. That was always a big challenge for us, getting locked encounters in a timely fashion. So now it's no longer, I would say it's no longer an issue.
A wonderful experience with ScribeEMR is just their flexibility in trying to solve just about any issue we're throwing their way. Yes, they are scribes and they do that wonderfully, but at the same time, we tried to figure out what other administrative tasks could a scribe be able to facilitate for us. We talked about facsimiles and handling incoming and outgoing faxes. We talked about referrals, closing that care gap. And now we have a new project that we're working on with them in our call center, or what we like to call our solution center, where our ScribeEMR team is fielding phone calls from our patients and solving their problems as well.
We did start to look at it and say, well, what other things could we fit into this square peg? Hopefully they wouldn't be round holes, but they would be square pegs, and we found a couple. One of them is the concept of doing referrals, and from there, what other kinds of straight administrative types of tasks could be done on a remote basis, and we would be able to feel good about that.
So Langley Health started working with ScribeEMR back in 2019 with the referral program. And what the referral program does is, as a federally qualified health center and a patient-centered medical home, Langley Health has certain requirements that they have to meet when it comes to referring patients. So ScribeEMR has helped us close the loop in those referrals that we send for our patients. In the beginning, we were at around a 75% rate, and now we're up to a 99% rate for closing the loop in those referrals. And then in the past couple of months, Langley Health has been working with ScribeEMR to implement a solution center to help with our call backlog.
The referral program is part of being a federally qualified community health center. And we don't have all the services that our patients require, so we have strong collaborative relationships with specialty providers. And during that process, our primary care providers put in a referral. ScribeEMR was very beneficial in working with us when we found ourselves unable to keep up with the volume in-house. So we've reached out, developed a workflow where ScribeEMR would help us gather the necessary documents from the specialty providers, get them back into our hands to our provider team so we could impact the patient outcomes and do so timely.
We had about 4,000 calls that were coming in, and the call handle time was about a little over 6 minutes. And now with ScribeEMR helping Langley Health with the call backlog and the voicemail backlog, we're able to lower the queue time for our patients to around 4 minutes from the previous 6, and we're also able to handle more calls as a result.
ScribeEMR ends up becoming an extension of our provider care team. It's a very, very unique situation where somebody who we've never actually even laid eyes on is now a part of our team. They're a team member just like we are. They are wearing a Langley Health Services name tag just like we are, and many of our providers treat them in that same fashion, going as far as to actually introducing the scribe to the patient during the exam. So you talk about the uniqueness of that situation. Here's an individual that could be worlds away, but they're actually hands-on in that patient's care right in that exam room.
I would have to say that we've had some testimonials by several of our providers because they feel like they create a real human connection with their scribe, and they feel like they know them as a personal and an individual.
After speaking with the providers, yes, it has been very positive feedback. I think they've all enjoyed it. An interesting aspect is they're spending 8 hours a day with this live person, and I think that they end up almost becoming friends. You know, it's become that friendly encounter, and they learn a little bit about each other. You know, you have a person who's halfway across the world, but they become close friends. As far as our physician recruitment goes, and retaining those quality physicians, I think that's something that we've encountered during our interview process that a lot of candidates are looking for or very encouraged to hear that it's even offered. And it's allowed us to recruit quality physicians and hopefully keep them for many years to come. You know, that added benefit of having a scribe, of not having to be as concerned with documentation because that's being done for you on the back end by a live person. You know, when providers hear this, it's something that is very enticing, something that says, hey, this might be a place I want to work at.
In order to have a visit, you have to have the time. And if you don't have sufficient time, if you're having to worry about not just the time it takes to see the patient, look them eyeball to eyeball, but also to then go sit down and type into a medical record or try to do the two simultaneously, that becomes a major constraint. We had the sense that we weren't getting what we wanted out of our electronic medical record, and this started the process of reversing that trend and making, in fact, the data much more accessible to us. Now when we have real reports from my folks, and I see real data, I know it's real. I know it's credible, and we're now able to extract that information in a way that makes a lot of sense to me as the CEO. We're able to grab that data now on a weekly basis. We compile it, we feed it back to the providers, they get to see how they're doing, we get to see how they're doing, and it's incredibly cool. It really is. It's for the first time we have absolute engagement, and in terms of closing our encounters, virtually 100% within 7 days, and that is really a good indicator of how effective the tool is. It's worth the time and effort to look at it and invest in it. If you have value for your staff, and you want to grow them and you have value for it in your mind for your patients, it works for them both, quite frankly, and the outcomes are outstanding.